Hello and welcome to Edukemy's YouTube channel and editorial discussion for 13th April 2022. My name is Harsh Singh and in this video we shall discuss an editorial from The Hindu which is titled HOPS as a Route to Universal Healthcare. If you like this initiative, share some love through likes, comments and shares. Let's get started. India as a country which spends on health expenditure is not ranked very good. In fact, the status of India is such that we spend 1.3% of the GDP on health. This is the public expenditure. Whereas the global average of expenditure is 6% of the GDP. And India plans to spend only as much as 2.5% of the GDP into healthcare by 2025. The stagnation is indicated very well through this image, where we see the health expenditure being around 1.2% for a decade. Whereas the countries like Japan, Germany, USA, UK, all of them have very good proportion of health expenditure as compared to the GDP of the countries. Even developing countries like Brazil and China have far better health expenditures. This is indicated very well through this image where you see a primary healthcare center which has been left dilapidated during emergency times like COVID. There are other ways in which one can see this figure. The institutional expenditure and the out of pocket expenditure, the proportion is such that out of pocket expenditure in India is very high, almost two-thirds of the total expenditure. India's expenditure in health is 3.6% of GDP, and two-thirds of it being met by the out of pocket expenses of the people. The average is around the world is only 20%, and India spends three times amount that. That means our individual expenditures are far higher and institutional are lesser. In fact, in institutional expenditure as well, the government expenditure is low and the private expenditure is far high. How can a poor person avail the private spendings? This is indicative of the fact that we do not spend much as an institution and government backing is less. This is where editorial says we must provide universal health care to people. The basic idea must be to provide healthcare to everybody, notwithstanding what is their background, economic status, or where they live. The lack of ability to pay should not be a determining factor when we look at providing such a basic service like health. And this is where countries around the world have worked wonders. Editorial says there are two ways of doing this. One is giving healthcare as a free service, and second, providing social insurance. Let us understand each of them. When a person catches a disease and they can be treated just by giving a small tablet. This is primary treatment. Do not need surgeries, do not need to go to a super specialty hospital. Preventive healthcare is the one where they get vaccinated or get some information where they help themselves prevent the disease than catching it. Prevention better than cure. And this model has worked in the capitalist economies and the socialist and communist economies both. The model is also available in India, where we have primary health centers and sub centers all providing primary treatment and preventive treatment to people. Yes. And on the other hand, the second scheme is social insurance. This is the one where everybody will be insured on health. And this will be a compulsory insurance, and the organizations which will be running this insurance scheme will not be running for profit. Then who will be paying the premium? The government will be paying the premium through a pool. A pool, for example, if they have taxed people, they will raise a separate pool through which they will be paying the premium. There are various models throughout the whole world. For example, countries like Australia and countries like Taiwan have a model in which the central government has the pool with them, the pool of finances, and they negotiate with one agency, one insurance agency, and they provide the premium for them, and the people, all the people receive social insurance. Another model where Canada operates is through provinces. Instead of the central government negotiating, there are four state governments and they are the ones which are negotiating with the insurance companies, right? So a little federated structure. And Germany has a model in which one insurance company is not there, there are multiple insurance companies and the government negotiates with each of them. Any Beat any of the models, the idea is to ensure everybody and run the organization as a non-for-profit organization. This is where the editorial says that there are some challenges in this model as well. First of all, we need primary health centers. See, a person will need health facilities or health emergencies in various cases. First, health facility is having preventive care so that the disease doesn't catch. They must be aware of how dengue happens, how malaria happens, what is the issue with diarrhea. So preventive care must be empowered. If they catch some issues like this, then a primary level treatment must be available to them. All this must be available in any case. So this is the first challenge, to provide primary health centers, right? So Ayushman Bharat scheme is running a scheme to upgrade the primary health centers into health and wellness centers. If you know, health and wellness centers, this is the one which is going to provide this particular scheme. And in case the person needs surgery or tertiary healthcare facilities, or some important exigency happens, they need to be shifted to a higher level hospital, right? District hospital or a super specialty hospital. This is where the social insurance will play a role. If they are not able to pay, they must be socially insured. So social insurance, this is how it helps. Now, can any treatment be accorded in social insurance? No, this is not possible. Some specific treatment can be accorded. For example, some small surgeries up to 50,000 rupees, or cancer treatment, or treatment of XYZ disease. This is to be accorded, because if there is no limitation on what should be covered under social insurance, then the private agencies will run for profit motive, and they will seek humongous amount of money from the one who is getting who's giving insurance, that is the government. Therefore, the scope and quality of insurance must be controlled. So these are two and three important challenges that must be addressed. And if addressed, both the schemes running together will help in providing health as an optional public service. Why optional? See, this is what will address and provide India as a destination for universal health service in the country. Universal health. This is how it will happen. Once we have to start providing health as an optional public service, where if people want, they can straight away use social insurance in case they need, and if they want, they can also go to primary health centers for the basic needs. This is how we initiate universal health schemes in India, and Tamil Nadu government is doing the right thing by bringing a law on the same. Now, the question for today is, state five ways to reform India's health sector. Just mention five challenges and or five ways to reform. For example, out-of-pocket expenditure should be reduced. For example, increasing the health facilities in rural areas must be given encouragement. Mention three challenges on the way, right? So just mention these 8 points, and this will be a great exercise for your brain. Write down in the comment section, and if you have any doubts, questions, or if you want any input, just put down a comment here and we will get back to you. If you like this initiative, share some love through likes, comments, and shares. Thank you for watching.